Welcome to the Canine Foster Training. This training is for unweaned and weaned puppies, nursing mom and puppies, medical cases, behavioral cases, low-end space, and our Happy Home Safe Home program. We'll be discussing each foster category and go over basic care for foster dogs. I'm so excited to have you join our HSSW family. This slide is going over contact information. If you need anything, please message or email me. You can also reach me at the phone number listed. If you have an emergency after hours, call the emergency on-call phone. The shelter is open every day, but the hours do vary. If you call and no one answers, please remember to leave a voicemail. Just a quick reminder, as the foster parent, you are responsible for transporting your foster dog. HSSW must approve any outside expenses, such as veterinary care. Legal ownership remains with HSSW. HSSW is the only one who can adopt foster pets into their new homes. If you know of anyone who wants to adopt your foster pet, please send them our way. Please remember, when you are taking your foster dog to the shelter or to a meet, you are always having them travel in a crate or in the back seat. Please remember to make the car comfortable by using heat in the colder season and air conditioning in the warmer seasons. When you arrive to HSSW, please remember to keep your foster pet contained at all times. If crating is not an option, please keep a safe distance away from other dogs and people, especially children. Alright, I know this looks like a lot. It kind of is, but don't worry. We are going to review basics for caring for a foster dog. Make sure you have space reserved for your foster. This space should be quiet and comfortable. Always have a crate in the room and keep the crate open for them to explore freely. Here at the shelter, we feed our dogs twice a day, morning and night. You'll be expected to give any medications that have been prescribed, as well as following any restrictions we have placed on your foster. Please remember to watch for any signs of illness or injury. If you have any concerns, please don't hesitate to reach out. You'll need to provide a clean environment for your foster pet daily. This means changing dirty bedding, food, and water bowls, as well as offering fresh food and water. You will also need to make sure that your foster pets are clean themselves. We recommend crating any foster dogs when you are not at home and during nighttime. Dogs do best with a routine, so try to stick to one as much as possible. Don't forget to take your foster dog on a walk at least once daily. The more the merrier. If your foster dog is especially jumpy or strong, let me know and I can get a harness for you. As with anything, even fostering, there are risks. There will be medical risks as we don't typically know the foster animal's previous medical history. There could be underlying medical complications. Because of this, there is risk to your pets. Please remember to quarantine your foster pet for at least 2 weeks and to have your animal up to date on vaccinations. Of course, not every foster case will go as planned, so please anticipate the foster care period to be longer than expected. Foster dogs will need time to adjust to their new environment. Please be patient with them. Lastly, it may take some time for your foster pet to feel comfortable with everyone and every pet. Please give it time, and of course, if it is simply not working out, please let me know and we can take the foster dog back. Now we're going to review Maddie's Pet Assistant app. You'll be sent an invite to the app once you take in a foster pet. Once you have the app, you can put in the pet's name, photos, and even bios. You'll take the scheduled surveys on your foster pet's progress. I review the surveys daily and contact fosters if necessary. Making sure your foster pet is given enough time to acclimate to its new surroundings is so important. Bouncing around place to place can be very stressful. You may see these signs of stress in the first 24 hours. Decreased appetite, exhaustion, diarrhea, panting, drooling, excessive shedding, and fearful behavior. If your foster dog is experiencing any of these signs, don't freak out. They usually level out in a couple of days. Feel free to let me know anyways, though. Before going into the foster's home, it is preferred the foster dogs meet with any younger children and dogs. Ultimately, it is the foster parent's choice if they would like to do the meet here at the shelter or by themselves. Please remember to give your foster pet a separate area away from any other animals to allow both parties to decompress. Majority of dogs sent into foster care will go up for adoption. Although we do majority of marketing to promote animals finding their next homes, we do love when fosters share their story on social media, as well as posting cute pictures. Please pause the video to get some tips and tricks. In the next couple of slides, we're going to go over basic care and what to provide for puppies aging from 0 days to 8 weeks. These are the key factors for caring for a puppy. You will need to keep the puppy clean and warm. Puppies are having a lot of firsts, which usually means a very messy time for both you and the pup. Please make sure you are giving sponge baths as needed by taking a warm, wet cloth and gently wiping down their face, legs, belly, and butt. Make sure you're cleaning their faces after each feeding and cleaning their butt area to avoid dermatitis. If dermatitis does occur, please let me know so I can give you some topical treatments. To keep them warm, use the snuggle safe that you were provided with. If the puppies are not warm, they will not eat. Another important step for caring for your foster puppy is weighing them. You'll want to make sure you are weighing them daily and around the same time each day. If your foster pups lose any weight, we need to know right away. In these next couple of slides, we're going to talk about feeding and general care for puppies aging 0 days to 2 weeks. In this slide, you can see what's to be expected. We're going to talk about feeding puppies under 2 weeks old. These puppies will need to be fed every 2 to 3 hours by bottle. They should have a robust appetite and want to eat. For pups without mom, we will supply a puppy milk replacer. Never give anything other than the puppy milk replacer. Remember to take each feeding slow, 1 drop at a time until they get the hang of it, and always feed in a horizontal position as shown in the picture. They should never be feeding on their backs. When they're under 2 weeks old, it's pretty much the same routine over and over again. Sleep, eat, repeat. When puppies are born, they are blind, deaf, and toothless, so they are quite literally helpless, and you will be expected to help them with everything, including feedings and stimulating them to go to the bathroom. To stimulate them, you will gently massage their anal and urinary region with a wet washcloth. Their weight should double in the first week, and their eyes should begin to open around 10 to 16 days in. In the next couple of slides, we'll be going over feeding and general care for puppies aging 3 to 4 weeks old. In this slide, you can see what's to be expected. Usually around 3 to 4 weeks, the weaning process may start. Once their teeth have erupted, they'll be ready. Start with a slurry mixture and feed every 4 to 5 hours. You may start to be getting some sleep. This is usually where they'll be able to take a break in the night, usually lasting around 8 hours. Along with introducing a new food source, you'll also be introducing water. Just remember, this is all new to them, so it's going to be quite messy. Make sure to keep the area as clean as possible. Now they're going to start to find their sense of momentum and mobility. You're going to want to make sure the area is clean and no toxic cleaning products are kept out and cords are kept away. They may start to use the bathroom on their own. Once they're ready, designate a spot for the puppy to use the bathroom. You're going to want to keep it close by and make sure you use lots of puppy pads. Keep an eye on their output. If it's runny, watery, or bloody, let us know right away. And remember to keep the area clean. In the next couple of slides, we're going to go over feeding and general care for puppies aging 5 to 6 weeks old. On this slide, you can see what's to be expected. Now that they've gotten the hand of the slurry mixture, at 5 weeks, it's time to introduce moistened kibble as well as continuing the slurry mixture. At 6 weeks, slowly transition to dry kibble and puppy pate wet food. They should be eating every 6 hours. When they're puppies, it's very important to socialize with them as much as possible and to introduce them to new people and experiences like vacuums, children, and stairs. In the next couple of slides, we're going to go over feeding and general care for puppies aging 7 to 8 weeks old. In this slide, you can see what's to be expected. The weaning process should be done, and they should be eating dry puppy food and pate-style puppy food, as well as eating every 6 to 8 hours. Generally at around 7 weeks, you can start to expand their room, give them the chance to relieve themselves away from their play area. You're going to want to continue to socialize and introduce new toys like chew toys. At 8 weeks old, you can introduce them to your pets, but your pets must be vaccinated. The nicest part about having mom with puppies is that mom will do majority of the work. You just have to assist along the way and make sure she's completing all the necessary tasks. You will have to give mom a nesting environment, something that is clean, warm, and quiet. Last but certainly not least, you'll be required to weigh the puppies daily as well as keeping track of their weights. If they are losing weight, let me know right away. When it comes to feeding a nursing mom with pups, mom should have the feeding down pat for the pups, but you'll still be required to provide food for mom. Make sure you are giving her fresh food and water daily. You'll want to offer puppy pate to mom as it packs a nutritional punch. If mom is a picky eater, let me know and I can get you some canned tuna or chicken for you to try. You'll know the pups are ready to eat when they're around 3 to 4 weeks old. You can follow the same weaning process in the previous slides, just replace the puppy milk replacer with water. In the next couple of slides, we're going to go over medical cases, behavioral cases, our Happy Home Safe Home program, as well as our low on space cases for adult dogs. Fostering a medical case sounds pretty intense, but it's usually not too bad. Just remember, if you have any questions or concerns, we're here to help you. The specifics of medical cases will vary. We will provide you with any information and care guides prior to you taking on the foster dog. Some of the more common medical cases are kennel cough, awaiting surgery, mange, and broken limbs. Fostering behavior cases are one of the most rewarding experiences. You'll be working with scared, elderly, or under-socialized dogs and pups. With these cases, you'll need to spend extra time with them and give them a comfortable, quiet, and smaller area for them to decompress. As long as the foster dog is eating, drinking, going to the bathroom, and not showing any signs of injury or illness, let them make the choice to interact with you. In order to get them interested in you and ultimately trust you, use treats. Treats will become your best friend in this process. Try to use moist, smelly treats like hot dogs. With behavior fosters, it's important to go slow and never rush anything. Never pull the dog from its kennel or allow strangers to interact with the dog, and never push the dog to do anything it's uncomfortable doing. Here's a couple of tips to help you with fostering behavior cases. Positive reinforcement is an awesome trick. Whenever they move toward you or another person, toss treats. When leashing the dog, do it without bending over them and instead bend at the knee. Standing over dogs is very threatening to them. Remember to give them space, don't get in their face or crowd over them. In partnership with Defy Domestic Abuse Beloit, HSSW's Happy Home Safe Home program is committed to helping survivors of domestic violence secure a safe place for their pets while they get in a better situation for both themselves and their pets. In this program, the foster will be more restricted in what they can do with the pets in this program, meaning they won't be able to take them out in public or post them on social media. They won't be able to introduce them to people outside of the household either. Pets in this program can be in foster anywhere from 1 month to 3 months, but never more than that. One of our more common foster cases is low on space or transport cases. These cases are for when we don't have a lot of room at the shelter because of excess strays, or we had a scheduled transport of dogs ranging anywhere from 10 to 30 dogs at a time. These cases will stay with you until they get adopted or until we have space for them at the shelter. Thank you for joining HSSW's foster team. You are officially a dog foster. We are so excited to have you. We wouldn't be the shelter we are without the help from fosters like you. Now that you are finished with the general orientation and the dog orientation, please email me to get started.